Hello guys, in this video we're going to talk about kinematics of the knee joint, alright? Now this is going to be a video that's continuing off the anatomy of the knee joint and ligaments, and I definitely recommend taking a look at that video. The link is going to be at the end of this one. Alright, let's jump into it. So over here we have a sagittal cut of the femur and the tibia. So let's say we're looking at it from the medial side over here. Okay, so this is going to be my femur up here. This is the posterior direction, this is the anterior direction, and this is my tibia down here. Okay, now looking at these surfaces over here, like I was mentioning in one of the previous videos, the tibial plateau is fairly flat. I think I was actually quite generous in giving it some curvature over here. It's probably a little bit more flat than that. All right. Because of that, right? What that's going to cause is that there's not going to be as much surface area contact between the two. And to make this more realistic, I think I should redraw this femur over here. I should redraw this femur to look something more like that. Okay. So there's not much surface area contact between these two. So this is the role of the menisci, of the lateral and medial menisci, okay? The lateral and medial menisci are essentially going to increase the amount of surface area contact between these two surfaces by essentially creating this little cradle, or creating this little cup for the femoral condyle to fit into, okay? And what this is going to do is that it's basically going to add stability to the whole structure, and it's also going to assist in the kinematic movements that we're going to see right now. So the kinematic movements that we're going to see, for example, this is in a completely extended position. So from here, we can only go into flexion. So let's say for flexion, okay, we want this femur essentially to roll down or rotate this way, okay? So if that femur rotates down this way, okay, and let's say this meniscus wasn't even here, right? Let's take this meniscus out just for the sake of this quick discussion right here. Okay. Let's say that meniscus wasn't even there, right? This femur, once it rotates backward, it will essentially roll off the tibial plateau, right? So the tibial plateau is going to be here, right? So it'll essentially roll off the tibial plateau or roll towards that further posterior end over here. Now, that's a problem because now you're not maintaining that surface area contact. You're destabilizing this joint. So what actually happens is that as this femur rolls backward, it's also going to slide forward, okay? It's going to slide forward at the same time. So what we're going to see is it's going to roll backward but then slide forward so that it maintains its position right in the middle of that tibial plateau and doesn't roll off the edge that way, okay? And the same thing is going to happen whenever the knee goes into extension, right? This tibia is going to roll and slide anteriorly. Okay, and likewise, this femur, as you go into extension, this femur would roll anteriorly and slide posteriorly. You see how that works, right? So this convex surface is going to roll and slide in opposite directions, whereas the concave surface is rolling and sliding in the same direction. Okay, that's going to be the movement that we're going to see there. Now, I want to bring this discussion to the screw home mechanism of the knee. All right, so let's pretend we basically take not a slice, but we look at this tibia from the superior view like so, okay? This is going to be over here the medial side, and this is going to be the lateral side. So this is the medial condyle of the tibial plateau, and this is the lateral condyle of the tibial plateau. This is exactly how it's structured. The medial condyle is more oval in shape because it's longer in the anterior posterior axis, okay? Whereas this lateral portion of the tibial plateau is more circular and shorter, okay? And when you look at the femur, the femoral condyles as well, you can see that this femoral condyle on the medial side is also longer than the lateral condyle on this side, okay? And then the lateral femoral condyle. So what that means is these two medial aspects fit very well together. And what that means is this. This means that as this leg goes into extension, right? Let's say it's moving like this, right? As this leg goes into extension, remember that we said that the kinematics are rolling and gliding, right? So this femur would be rolling anteriorly and then gliding posteriorly, but as it keeps on going and going, this tibia gets pulled forward, and what's going to happen is that there's more space for rolling and gliding on the medial side than there is for the lateral side. So at a certain point, the movement stops here, inside this part of the joint on the lateral side, because there's no more movement for it to move. So it stops, but there's still movement here, okay? Which means that as it continues to go into terminal extension, the tibia, because this medial side can still move more, the medial side is going to continue to move, and the tibia is going to slightly rotate laterally, like so. Okay, so it's here. As it goes into terminal extension, it's going to slightly rotate laterally, like so. Okay, and that is known as a screw home mechanism. This is what's going to lock the knee joint into its closed packed position. Okay, closed packed position means the position where the articular surfaces are most congruent and the ligaments are taut. All right, now this means that in order for it to go back into flexion, right, you need something to unlock that, or to rotate that tibia medially to then pull it into flexion. Okay, so that's going to be the unlocking of that screw home mechanism. The muscle that does that is the popliteus muscle, or I should say the muscle that contributes to that is the popliteus muscle. Okay, and later when we talk about a discussion of the musculature in the lower extremity, you'll see how the popliteus muscle does that. Okay, so that's just introducing you to that concept right there. All right, so in this video, we talked about the knee kinematics. We also talked about the screw home mechanism of the knee. This is to accompany the other video of the leg and knee osteology. All right, see you guys in the next one.